You know, when we think of a surgeon, we often picture someone with almost superhuman skill, right? A rock-steady hand. But what really makes a surgeon great? Well, it turns out it's a lot more than just that. Today, we're diving into a really cool, modern framework for surgical excellence that kind of redefines the whole idea of mastery. So let's just start with that big question right there. Beyond those steady hands, what is the secret sauce? The answer is this really powerful mix of skills, and getting a handle on them is absolutely key to training the next generation of masters. All right, here's how we're going to break it down. We'll kick things off with a quick look back at the history of surgical education, and then we'll get to a modern answer for this age-old question. We'll explore the 3 pillars of mastery, and we've even got a great racing analogy to make it all click. And finally, we'll talk about the ultimate responsibility, passing it all on. You know, this whole idea of how to train the best surgeons, it's not new at all. For decades, the leaders in surgery have been wrestling with how to best educate the next generation, who should be responsible for it, and how to keep quality high in such a high-pressure world. And you can actually see this conversation evolving over the years if you look back at these presidential addresses. Back in '76, Dr. Müller was all about setting educational standards. By '83, Dr. Smith was asking the really tough questions, like, hey, whose job is it to train these future specialists? Then in '89, Dr. Polk was raising the alarm about outside pressures threatening quality. All of this really sets the stage for a more modern, focused answer. And that question of responsibility, wow, Dr. Richard Smith just hit the nail on the head with this quote. It so perfectly captures the ethical tightrope that every teaching surgeon has to walk. How do you give a trainee the real, hands-on experience they absolutely need to become great, while making sure the patient is completely safe? It's a huge dilemma. Okay, so let's fast forward to 2016. Dr. Neil F. Jones gives this presidential address that finally offers a clear, actionable way to tackle these old questions. And his focus wasn't just on making surgeons who were, competent. It was about inspiring true excellence. Dr. Jones framed the challenge just beautifully. He asked, how do we light a fire in our trainees? See, it's not just about downloading information into someone's brain. It's about sparking curiosity, creating genuine excitement, and growing this deep, driving passion for the craft.
And look, this isn't just some abstract, philosophical idea. It has real-world consequences. If you look at this data, you can see the percentage of plastic surgeons in the American Society for Surgery of the Hand has dropped a lot since 1946. To keep a specialized field like this healthy and vibrant, you have to go out and actively inspire and attract the best new talent from everywhere.
So, how do you light that fire? Well, Dr. Jones lays out this framework built on 3 fundamental pillars. This is the heart of his entire approach. And to really help it stick, let's imagine a master surgeon as a Formula One racing driver.
All right, so here they are. The 3 pillars are surgical technique, surgical judgment, and the surgeon-patient relationship. Let's break each one down and see how they play out, both in the operating room and out there on the racetrack.
First up, Pillar 1, surgical technique. This is the foundation, right? The how-to of surgery. In our racing analogy, this is the driver's raw physical skill. We're talking everything from basic suturing all the way to incredibly complex microsurgery. But it's not just about what's taught, it's about how.
Dr. Jones basically says that old motto, see one, do one, teach one? Forget it. It's just not good enough for a field as precise and detailed as hand surgery. Instead, he talks about the conductor model. The senior surgeon is like the conductor of an orchestra, right there, guiding the fellow through every single tiny detail of the procedure, from the very first cut to the final splint, making sure every note is perfect.
The second pillar is surgical judgment. And listen, Dr. Jones argues this might be even more crucial than technical skill. This is the why and the when of surgery, not just the how. For our racing driver, this isn't about how well they can steer. It's the mental game of knowing exactly when to accelerate into a corner and when to hit the brakes. And this idea goes way back. It's perfectly captured by this 18th century surgeon, John Hunter. His principle is really the bedrock of surgical judgment. Is this operation absolutely necessary? And would I have this done to me? It's all about knowing which patients to operate on, which to treat without surgery, and maybe most importantly, which patients you should never operate on.
So what's really fascinating here is how you learn this. You can't just read judgment in a textbook. Dr. Jones says it's learned by osmosis. Fellows just sort of absorb it by watching their mentors in the clinic. They don't just see what decision is made, but they hear how it's explained to the patient. And critically, they see the results of those decisions months, even years down the road.
And that brings us to our final pillar, the surgeon-patient relationship. This is the human element. This is where the science of surgery meets the art of medicine. A technically perfect surgery can still feel like a failure if that human connection is missing. For our race car driver, this is the communication with the pit crew. Without it, the race is lost, plain and simple.
And just like judgment, this is also learned by watching. A fellow sees many different senior surgeons interacting with their patients. They see what works, what doesn't, and slowly they start to piece together the best practices to create their own unique professional identity. It's a process of building a style that's both effective and, most importantly, authentic to them.
Okay, we've been dropping hints about this the whole time, but let's really lock it in. This analogy that Dr. Jones uses of the surgeon as a high-performance racing driver is what makes this whole framework just click into place. So let's recap. Surgical technique, that's the driver's raw physical skill, perfect steering, flawless shifting. Surgical judgment, that's the mental strategy, knowing exactly when to push, when to hold back, when to make a pit stop. It's what keeps you from crashing. And the surgeon-patient relationship, well, that's that vital, trusting communication with the pit crew. Without it, even the best driver in the fastest car is going to fail. And all of this, all three pillars, they lead us to this final and maybe the most important point in Dr. Jones's whole message. It's not enough to become a master yourself. The ultimate responsibility is to pass it on.
And this isn't just talk, it's about walking the walk. This photo here shows Dr. Jones himself living out his philosophy, teaching local surgeons in Cambodia. This is what teaching hands pass it on looks like in the real world. It's about building a legacy of excellence that goes way beyond your own operating room.
Dr. Jones actually ended his address with this beautiful quote from the play, The History Boys. It just captures the whole spirit of mentorship so perfectly. You take the knowledge, you make it your own, you really feel it, and then you pass it on. That's the name of the game.
So it leaves us all with a final thought, doesn't it? This framework isn't just for surgery. These three pillars, technique, judgment, and relationships, and that ultimate duty to mentor others, that applies to almost any field of expertise. It makes you ask yourself the question, what knowledge, what skills, what passion are you passing on?